This is an exercise series I put together for cervix health, targeting some of the areas where the cervix is integrated in with ligaments and fascia and muscular attachments. We're going to start on our hands and knees with a little warm-up of cat-cow, moving that pelvis and spine. So we're going to inhale as your pelvis tips forward, and then your spine follows and your head ends. Exhale as your pelvis tucks under, spine follows, head tucks under. Let's do this 4 more times. Keep your shoulders away from your ears. Really lengthen through your spine at your own pace. Going through whatever range feels comfortable for you. If the full range is not comfortable, start with just your pelvis. At the end, settle into neutral. You're going to walk your hands slightly forward, tuck your toes under, and we're going to lift up into a down dog inversion. So inhale, as you exhale, press through those heels, lifting your butt towards the ceiling, dropping your head. And then you're going to turn your hips in to pigeon toe your feet. From here, you're going to take some nice deep breaths into your pelvis. And then we're going to lift up onto the toes and lower back down. Lift up and lower. You can inhale and exhale. Feeling that stretch. Really pressing through the hands to keep yourself nice and stable. Last one. Turn your legs back to neutral. Drop back down onto your knees. And we are going to sit back into a deep squat. Now, if a deep squat is not comfortable for you, you can always sit on something. So you can sit on a block, you can sit on a bolster, you can get a cushion off of the couch, and you can sit on it in this deep squat. If it is comfortable for you to be in a deep squat, not sitting on anything, that is perfectly okay as well. From here, what you are going to do, I'm going to show you sitting, is we're going to be rotating. So arms are going to be in between the legs. You're going to inhale as you reach towards the ceiling, and then exhale back to center. Inhale, reach to the ceiling, and exhale back to center. And the opposite arm is pressing into the opposite knee, and then back to center. So my right arm is pressing into my right knee right now. So we're doing 3 more sets of these. Inhale and exhale. If you are worried about rotating, I would exhale to engage my pelvic floor and my abdominals, that core breath as I reached for the ceiling. And then to provide more stability, if you're not worried about twisting, then we can do it with the inhale. From here, we're going to move whatever you are sitting on. And you're going to sit right down onto the floor, and your legs are going to come out in front of you. From here, hands can be down onto the floor to help with balance, but we are going to turn our legs to one side. You're going to twist and rotate those legs, going into a Z-sit, and then we're going to exhale, come back to center, and inhale, twist in a Z-sit to the opposite direction. Exhale, inhale. whatever pace feels comfortable for you. 2 more sets. Last set. Back to center. Okay, from here, we're gonna lie onto our side and then back onto our back. Cross one ankle onto the opposite knee and then draw that leg in. And then we're gonna do little rocks back and forth. Breathing into the pelvis, expanding with that inhale. Doing about 10 rocks. And then switching sides. And then we're going to lengthen out one leg and draw the opposite knee into our chest. We're going to be here for 3 breaths. This one is actually nice to expand the belly and the ribs. Lower your leg, bend your knee, straighten and pull in. 3 breaths. Bend both of your knees. We're going to bring both knees into your chest. And then you can either go up into a happy baby, or you can hug behind the knees, whatever is more comfortable, but your knees are out towards the shoulders. And again, 3 breaths. Really feeling the expansion in the pelvis. Bring your knees together and lower them down. You can do this daily. You can do this every other day. It's great to do right before bed to kind of calm down. So give it a try just for overall cervix health, or if you're having some pelvic floor pain or some pelvic pain, you can give it a try. Always go through the range that is comfortable, not really trying to go through a range that is uncomfortable, and moving through to progress to more mobility.